And this guest, I can tell, comes from a really good family. Welcome to the M4J podcast. I am your host, Xavier Humphrey, your career and academic strategist, bringing you over 20 years of career development and talent management experience. M4J, meaningful, engaging experience and talent for jobs. This is going to be our exploration series, meaning we're going to focus on exploring careers, but not talk about the outcome. We're going to talk about the process of actually getting into a career because we always focus on the outcome, right? How much you're going to get paid and bonuses and all that stuff, which is great. But we're going to actually focus on the process, okay? And we got a special guest here today. And this guest, I can tell, comes from a really good family. I just get that. I get that feeling. He comes from a really good family and a very good education. And I'm not gonna even try to remember all the education. I got my notes right here. So let's start off with this intro, talking about your education. Bachelor's degree in kinesiology and exercise science from the University of Florida. Master's degree in physical therapy, University of North Florida. Doctoral degree in physical therapy from University of St. Augustine. MTC, manual therapy certification. OCS, orthopedic clinical specialist. My baby brother from the same mother, Dr. Lydell Humphrey. How are you, sir? It is
Good, good,
great to have you.
good. I didn't know you did all that research. You knew about all of that.
Yeah, I did my research, bro. I
Yeah,
had to. I
awesome.
had to, man. You took the time. I know you're busy. You got family. You
Yeah.
work. So I wanted to take the time to do the research on you because I take this very seriously, what you
Mhm.
do, and I'm very proud of you. Also, very proud of you. Before we actually get into the process of you becoming a physical therapist, could you actually explain what is orthopedic clinical specialist? What is that?
So that's like okay. So that's like every profession has a specialty. So you got orthopedics, neuroscience, pediatrics, just like medicine does. So basically, and there's a sports certification too. This is by the American Physical Therapy Association. They have their little pedigrees, and that's like the highest thing you can get for orthopedics and physical therapy, basically. So there's only like 8,000 probably people in the world that can do it. So yeah, so
Wow.
it was a pretty intense, certification. But yeah, so you know all your stuff about ortho,
It
manual therapy. So yeah,
it sounds intense.
yeah.
What initially made you get into physical therapy?
Okay, so initially I would say I was into medicine and I like sports. So yeah, when I was at UF, I was exercise science. I was undergrad, med school, and then I just kind of got disencouraged with the whole med school process. And but then I got a letter in the mail, and it said, "Hey, you're eligible for physical therapy." And then I didn't realize how intense it was getting at. It was just as hard as med school. It was like basically a third of the students apply to get in the program. It was tough. So I went to a counselor at UF, and they told me, "Oh, well, you got to get your grades up, to get into this program." So I started working on it. I still want to do it, and I did an internship for exercise science at a physical therapy clinic, outpatient. I was like, "Oh, this is what I want to do." So then I decided to pursue it. Um, Moved to Jacksonville after I graduated. Heard UNF had a program. Didn't get in the first year. Just like they said, Michael Jordan got cut from his basketball team. Same thing. Didn't give up. Next year applied and got in. Was it? And
So,
I met with the director, and we got in after that.
what is your current position and how did you land that position?
Current position as center manager at Select Physical Therapy Northside. So this was a position I wouldn't say land, is more like earned. I was hired as a PRN therapist, floating around. Then I found a home in Orange Park, working there at that clinic, and then the area manager asked if I would transfer to Northside. I was a therapist there, and then she started noticing good outcomes. Patients was coming in, the volume was good. She's like, "Hey, what do you want to do next?" Oh, she hinted, "Yeah, manager, promote to." So I had to go through an interview process for that. Get interviewed by like three people, senior management, human resources, all that stuff. After like working there for 4 years, and that's how I became center manager. Been doing it for like the last 3 years,
Sure.
which is awesome. I like. It's better when you work for it than it's given to you.
A typical day for you.
Typical day, just getting up, going to see my patients, doing evaluations, a lot of coaching, supervision, whether it's a PTA or front desk, students, interns. So it's more like instead of just being and of course treating too. So I'm a consultant at this point too, because everyone's coming up to me asking me for advice. So I'm like training the other therapists what to do, how to bill appropriately too. So I'll see like maybe 12 patients on my schedule. Do a lot of poets, which is post offer employment physicals, basically before they get a job.
You mentioned something about training. What is the difference between an athletic trainer and a physical therapist? Because a lot of people get those confused. Am I correct?
Yeah, yeah, yeah. There's a difference. So athletic trainers are basically they're skilled care, but it's more in the athletic field to get the athlete to return as quickly as possible to a sport. Whereas a physical therapist is more like working on function, things like that. Whether it's a different population, workers' comp, elderly. Um, but then on the field, we can do some of the same things as well. So there's a difference. Yeah,
Okay. But an athletic trainer does not have to complete as much education as you.
yeah. It's more of a bachelor's degree just to do athletic trainer. And then PT is a doctorate degree. So when I was in PT school at UNF, half the class that I was in, they were athletic trainers looking to go into PT school afterwards. After the bachelor.
Okay.
Yep. Yeah. And the skills that they learned in AT is crazy. They had to change the way of their thinking in PT school. You'd be surprised. Some things are similar. They knew how to use a
Hmm.
goniometer, do on the field assessments, but it was a whole new ball game when they got into PT school, learn different things. So yeah,
Thank you. Thank you for clarifying
that
that.
yeah, I remember in my PT school, we started out with 33, and we always say started out, and the class got smaller. But there were some ATs that didn't make it that first year or a couple years, and then some. I mean, they had another year to come back or whatever, maybe personal issues or whatnot. But yeah, so it was different.
A lot of people did not make the cut that
Yeah,
got there.
yeah. Usually doesn't happen. Like everybody does it after that first year. Yeah, it's usually that first year, that first semester. Yeah,
How do you apply yourself to make the cut?
time management, paying attention to details. That's really the biggest thing. Good study habits and just you know taken for what they're saying. They're telling you everything you got to know, and then after that, it becomes thinking outside the box. It's not just concrete learning this X, Y, and Z. It's like, okay, how do you apply what you learn? That's the biggest thing.
And what does a starting salary look like for a physical therapist?
Wow, these days, I would say they're starting them out around like 70 to 75 if they're a newer grad. With experience, you're getting more like maybe 80 or so. Yep.
What advice would you give someone interested in becoming a physical therapist or getting into this field?
Getting exposure, getting your observation hours, of course, is good. And whether it's outpatient or
Okay.
Yep. That's the biggest thing. And then taking your prereqs, like they said, and then just really getting like your psychomotor skills, which is good. Whether even if you're working as like a tech at Brooks or something like that, or well, in Jacksonville we call it Brooks, whatever your rehab hospitals are out here. You know,
Is it really possible to gain muscle and burn fat simultaneously? Because
absolutely,
seriously, if you listen to the internet,
yes.
your brain is going to start bleeding out your ears because everybody's saying so many different things.
Well, that's bro science, as people are listening to. Yeah, you can. That's bro science. Yes, you can
That's
build
bro
muscle, burn fat at
science.
the same time. So it's not like, yeah, you can lean bulk, or I mean, you're gonna if you're getting, they say you got to be in a caloric surplus, but you can still burn fat. Either way, it depends on your
Okay,
diet. But yeah, you can do both at the same time. It
you
takes
can do both.
longer, but it can happen. Yeah,
It can happen.
yeah,
Okay.
that's probably the right way to do it too. But yeah.
So, what are the plans for you in the future with physical therapy? Like,
Continue to grow the clinic I'm managing, grow staff, keep moving up with that. And then, of course, I got my side jobs with it, and then continue to grow that practice, and then, see what happens with that, grow the business, whether either I decide to stay corporate, which is safer, the corporate
okay,
ladder, as opposed to starting own practice, which is risky. You know,
right.
I would say I would either do one of my own things. If I wasn't doing this job, then I'd be like, well, I'd hire myself. But yeah, this is a safe haven.
So you've thought about the entrepreneurial route. You've
Yeah,
thought about that.
I thought about that. Yeah, but high risk. So we'll see.
Right, of
I want to look
course.
for. Yep. But yeah, if I wasn't here, that's something I would do. Yep. Yep.
This was important for you to come onto this podcast because of I'm trying to build this community, and this community is not just about me. It's bigger than me. It's about the job seekers. It's about people that's trying to go to college, trying to get some training, and be able to get information from professionals such as yourself, recruiters, to not ease the process because I don't think a process, if you really want something, is going to be all that easy. So they can understand that
Mhm.
it is going to be difficult,
Yeah.
but they can get
It
through
doesn't.
those
It doesn't happen
difficult times.
overnight either. You know.
And it doesn't happen overnight. No, I appreciate you coming on here and,
Mhm.
and talking about your expertise
Oh
and
yeah,
what
definitely.
it took for you to get into this field. I respect you, love you.
Hmm.
I'm very proud of you,
Yeah. Thank
and you're now a part of this community
you. Yep.
now,
All right.
as you being the first guest on this exploration series.
All right.
Thank you so much,
All right.
Dr. Lydell Humphrey, for
Thank
coming
you.
on to the show.
Yep.
Have a great evening with your family and
Yeah.
take care. And I'm very proud of you.
Hey, thank you, and go Gators.
Go Gators, of course. All right. Talk to you later, brother.
All right. Okay.